It's also important for them to be aware of the growth and development patterns of the jaws, the consequences of tooth loss, and in particular, the resulting sequence of alveolar bone resorption following tooth extraction. They should also have an awareness of pathologic processes that can occur in the maxilla, the mandible, and surrounding tissues. Prior to implant training, a dentist must have sufficient education in medicine as it pertains to dentistry. Dentists should be aware of physical, psychological, and medical conditions that may impact upon dental treatment. This includes an awareness of the effects and side effects of commonly used medications and medical treatments for common conditions. It's also important to recognize conditions that may affect a patient's ability to provide informed consent to treatment, and conditions that may affect normal blood clotting or wound healing. Any dentist wishing to surgically place dental implants should have a good knowledge of the appropriate use of pharmaceuticals in the practice of dentistry. This includes a working knowledge of the use of local anesthetic agents and techniques, as well as the use of analgesics for the relief of pain. The dentist must also know the role and appropriate use of antimicrobials in the prevention and control of infection. Dentists should be aware of the pharmacodynamics of such agents, their common interactions, and contraindications for their use. Sufficient knowledge in the field of oral medicine is also required. Oral medicine is the diagnosis and non-surgical management of conditions that affect the oral cavity and maxillofacial region. These conditions may be chronic, recurrent, and/or medically related. Dentists should be aware that such conditions may affect the oral cavity and associated tissues and structures, or manifest in the hard and soft tissues of the maxilla, mandible, and related structures. They should also be aware of the impact of systemic medical conditions upon these tissues, and how such conditions can impact upon dental, surgical, and prosthetic treatment. Oral biology and medicine, key learning points. Dentists who plan to start training in implant therapy must have a good working knowledge of oral biology and medicine, including the pathophysiologic processes that occur in the maxilla, mandible, and surrounding tissues, systemic medical conditions and oral medical conditions that can impact upon dental, surgical, and prosthetic treatment, and pharmacology as it relates to dentistry, including the use of local anesthetics, analgesics, and antimicrobials, as well as how other pharmacological agents taken by the patient may influence dental treatment. General dental knowledge and clinical skills for implant dentistry, module summary. Certain key knowledge and skills are required before a dentist commences training in dental implant treatment, including patient assessment and treatment planning. A practical level of skill in radiology, oral surgery, periodontology, prosthodontics, endodontics, and orthodontics is required in order to safely provide implant therapy for patients. Many of the core areas of knowledge required to provide dental implant treatment need regular updating. Provision of implant therapy also calls for a broad base of knowledge in the areas of oral biology and medicine.